Mr. Speaker, officers, delegates, physician colleagues, distinguished guests. Had enough of these virtual meetings yet? This is our fourth in a row, but who's counting? First, let me thank each and every one of you who's responded to the pandemic. Physicians have shown great courage in the face of difficulty over the past many months, even up until this very day as the battle goes on. My physician colleagues, my battle partners, indeed my fellow COVID veterans, soldier on answering the call. Even as this Delta surge wanes, we anticipate entering a third calendar year of this global pandemic and have surpassed 750,000 lives lost to COVID in the United States alone. Just a staggering and heartbreaking milestone to reach. And yet questions remain. Are we near the end? Will there be another surge? Will vaccinations hold up against future mutations? We don't have those answers yet. I want you to imagine a small community hospital in a rural area of a southern state a year and a half into the pandemic. The COVID Delta variant surging, vaccination rate lags, the hospital and ICU have been operating well above 100% capacity for more than a month. The ICU is filled with COVID patients, 90% of whom are unvaccinated and 2/3 of them under age 60. Inpatient beds are overflowing into the hospital hallways. Emergency room and PACU beds doubled as critical care beds as patients struggle to breathe. With these younger, sicker patients comes a new dynamic for many doctors and nurses. They're now witnessing young families and their children watching through barriers or covered in PPE as their loved ones succumb to a devastating virus. Healthcare workers are taking extra shifts and giving it their all, but they're showing signs of exhaustion as they deal with the physical and the emotional trauma. Young clinicians in particular appear shell-shocked and seem to be even questioning their career choices. To many of you, this might sound all too familiar. In fact, the scenario I just described took place at my community hospital in Georgetown County, South Carolina, during a grueling 7-day, 100-hour teaching rotation that I led. The fear and the weariness in young clinicians' faces was not unlike what I witnessed in the medical arena in Iraqi freedom and enduring freedom after 9/11. I'd call it battle fatigue, like combat. The unrelenting demands of responding to COVID patients has led to physical and emotional exhaustion and pushed physicians and our entire healthcare workforce nearly to the breaking point. What will be the lasting effects of this pandemic on young doctors? Will they leave their chosen specialties or even the profession? What will it mean for the future of healthcare? We don't have those answers yet, and it's a difficult feeling to live with day after day. Our psychiatry friends will tell you that the human brain is challenged by uncertain situations and outcomes, and faced with uncertainty, we may feel threatened, unable to concentrate, and less capable of solving problems. During such uncertain times, it's critical that we find support and social connection. Where will physicians, especially young doctors and those in training, find that support? I'd submit that we must be that support. We at the AMA and all the state and specialty medical societies who comprise the House of Medicine. We must be the allies of our physician colleagues that we need right now. A few months ago, one of our Federation partners, the West Virginia State Medical Association, asked me to speak to the question, do we still need organized medicine? You might think the answer is obvious. Heck yeah. But here's why. Throughout the pandemic, the AMA and our state and specialty medical associations have stepped up and bridged many gaps. We've gotten doctors and other healthcare workers the information, the personal protective equipment, and other resources they needed, even as the state and federal government struggled in a deficient public health system. When I use the term organized medicine, I don't mean an abstract concept. I mean our people, our purpose, our actions in support of a profession built on ethics and science, and that is focused on providing the best possible care for patients in ways that also strengthen our communities. Organized medicine means hundreds of thousands of physicians, students, trainees from every state and specialty in the United States, gifted and talented practitioners, researchers, and academics. Organized medicine means our common purpose, which is to promote the art and science of medicine and the betterment of public health, the AMA mission statement. And organized medicine refers to those specific actions we must be doing to help physicians meet the challenges of this pandemic and beyond. When we first encountered the novel coronavirus in the early 2020, the AMA and our partners in organized medicine responded. We fought for the PPE. We fought for financial resources. We were a reliable source of evidence-based information on COVID the physicians needed during a time of mixed messaging. We talked with CMS to expand telehealth and to pause the regulations that were standing in the way. We pushed insurers to drop prior authorization requirements. And most importantly, we fought against misinformation and disinformation at every step. We continue now to call out half-truths and lies. We're educating those who are open to science-based information. Colleagues, don't believe the myth that all who are unvaccinated are hardened in that position. In fact, research shows that if we as doctors, if we recommend vaccines to our patients, they're inclined to take them. My state only has a little over half its population vaccinated right now. And last month, I spoke to a group of maybe 50 employees about vaccines, and I used the point that many in the community had either trusted me personally or their families had trusted me with their medical care, from sprained ankles to heart attacks to cancer. And yet, they had some hesitations and questions about the COVID vaccine that were largely prompted due to nonstop misinformation and half-truths. I reminded them they had sought my advice for decades. So my advice remained to take my advice. Take the vaccine. Afterwards, many of these vaccine hesitants stepped up to me and thanked me, and they said, I'm convinced now, Dr. Harmon. Where can I get my shot? My story, multiplied by those from colleagues across the country, speaks to the power that we have as individual doctors and, in turn, the power, the reach, and the impact we can have as organized medicine, as purveyors of truth on the side of science. As this audience knows, the value of organized medicine is much broader than the pandemic response. Challenges in medicine existed long before COVID-19 and are going to continue long after the worst is over. Physicians face bureaucratic and regulatory obstacles to care that contribute to burnout. Organized medicine has not lost sight of those battles. In fact, the pandemic has shined a spotlight on the breadth of challenges we face. Dysfunctional Medicare physician payment system, scope of practice expansion, electronic records, data transparency, chronic disease management, prior authorization, health disparities, equity concerns. We've committed teams at AMA working on each of these healthcare challenges and many, many more, and I'm so very grateful for their efforts and appreciate them. Let me highlight 3 issues that are of utmost importance to us right now. First, we need the strength of organized medicine in the battle against Medicare payment cuts, a battle that is going to have to be refought again this year. We're facing potential Medicare cuts of nearly 10% beginning in January 2022. It's about time Congress passed a permanent solution to end these annual battles that threaten the solvency of physician practices. Congress must address physician budget neutrality and inadequate annual payment updates as the root causes. We also need the strength of organized medicine to fight aggravating payer policies that really hurt rather than help our patients. Now, I want to keep this speech in the PG rating mode, but I've got to use that dirty word, prior authorization. Recently, a friend and a patient, former patient of mine, presented with some ill-defined symptoms. He had kind of slight cognitive impairments, intermittent complaints of difficulty walking, especially when he was on the golf course. Now, he was over 70, he had hypertension, he had diabetes. He was being followed by an endocrinologist or a physician assistant who was working with him, but less often seeing his primary care doctor. He had a benign CAT scan of his head, and the feeling by many of his providers was tending towards the diagnosis of vascular dementia or Parkinson's. I wondered about normal pressure hydrocephalus, or NPH, and so I ordered an MRI of his brain. Now, his Medicare Advantage Plan benefits manager pushed back on the study and said, "We're going to deny it." I disagreed. I spent a half an hour on the phone arguing, finally prevailed. Sure enough, that MRI was consistent with normal pressure hydrocephalus, and my neurosurgeon colleagues are now taking him to surgery. Now, if I had not fought this decision, if we had not fought it, the delay in care would likely have resulted in the patient's condition deteriorating, could have caused certainly greater disability and possibly even death down the road. Well, that's just foolish. When an insurance company is making the decision rather than a doctor, it's probably going to be in favor of the short-term financial gain. That's why the AMA is pushing for legislative action on prior authorization and step therapy reforms at the federal and the state levels. And finally, we also need the strength of organized medicine when it comes to correcting the past wrongs of our profession and creating a healthcare system that is responsive to the needs of all patients. The impact of systemic racism in medicine, past and present, is real. The pandemic and social unrest of the past 20 months has shown all too clearly how policies such as segregation, mass incarceration, police brutality, and redlining continue to adversely affect the health of Black and brown communities and individuals. We're committed to our strategic plan to embed health equity and racial justice within the AMA and within the larger healthcare system. The plan is ambitious and far-reaching. It will be the subject of an educational session during this meeting, and I encourage everyone to attend to learn more. Our work to date has been earnest, it has noble ambitions, and is critical to the health of our nation. The point is, a single physician cannot bring about the legislative or regulatory changes needed to improve the practice environment, but membership in organized medicine multiplies our power, our resources, and our voices by hundreds of thousands of physicians. I was a big fan of the late General Colin Powell, who famously said, "Perpetual optimism is a force multiplier." I've been accused of being pathologically optimistic, and I want us to remain focused on all that we face. But I can assure you that we haven't lost a fight, whether we're talking about COVID-19 or burnout or any other challenge. The AMA and its federation partners are strong. We're an army against the virus. We're an army against injustice, an army against an unresponsive bureaucracy and distracted legislators. We're strong in the support of our colleagues, both individually and collectively. We're strong in envisioning the end of this pandemic and a brighter age for health care. There'll be yet uncertain times ahead. We can walk with confidence into this future because through organized medicine, we know we're not walking alone. It's been a long couple of years. I encourage you to persevere through what remains a consequential time in the nation's history and the history of medicine. I encourage us once more to act worthy of ourselves on behalf of future generations. And I thank you.